Good evening, everyone. Hope you're all having a really great night and had a great day. You'll have to forgive me a bit on this one. I'm getting over a cold, so I'm going to be doing this while sucking on a cough drop, trying to salvage the wreckage of my throat right now. A lot of colds have been going around lately, it seems like, at least here in London, around my school. A lot of people are getting sick, and it's a real shame I ended up catching it as well, but I hope everyone watching, I hope you're all feeling well and not sick at all. And I've also got my tea right here. Love the smell of that. Made myself a nice hot cup of tea. So even though I'm a bit under the weather, I really wanted to get back to reading some more of this book to everyone because I'm really enjoying this book. I have read a little bit more of it on my own, but as you can see, I've made quite a dent in it. But I'm just really enjoying reading this book, and I'm enjoying reading it to you, and I hope you're enjoying having it read to you. And hopefully this will still be a nice little reading session in spite of how my throat is faring tonight. So let's go ahead and get back started in here. Thursday, 14th of September, 2006. Patient CW on the antenatal ward needs some imaging done of her lungs. So I book her in for an MRI and go through the checklist. Ordinarily, you do a CT scan, but we try to avoid those in pregnancy as they involve a large quantity of X-ray exposure, and anyone who stayed up for the late night horror can tell you that radiation plus baby is not a good idea. I've had the mechanism of MRIs explained to me any number of times, and I'm still none the wiser. But no X-rays are involved. Images are obtained using a combination of protons, magic, and an enormous fucking magnet. And I mean enormous. The size and weight of a one-bedroom flat. The MRI checklist asks if they've got a metal heart valve. It would tear out their now dead chest at 80 miles per hour and splat onto the machine. Or worked in a metal factory. Tiny bits of metal would have found their way into their eyes, making both eyeballs explode upon opening the door to the MRI suite. She is in fact ineligible for an MRI, having had a small but powerful magnet implanted in the pulp of her right index finger a few years ago. Apparently, there had been a limited trend for this, performed by tattoo artists and intended to give the recipient an extra sense, an otherworldly awareness of metal objects around them, like a kind of vibrating aura, her words, or a slightly low-rent X-Man, my words. Her sales pitch needs work, to be honest. It turned out not to be the mystical, ethereal experience she had been looking for, but a regal pain in the arse. She tells me it's become infected a number of times, and going through airport security is now a living hell. I briefly toy with asking her to brush past my colleague Cormac to either confirm or refute the rumor that he has a Prince Albert. The already close to zero appeal of a genital piercing instantly evaporated as a house officer when I saw a patient present with a ring that had ripped out during sex. This happens frequently enough that urologists have a term for it: Prince Albert's revenge. She says the implant has recently become either dislodged or demagnetized, and now she barely feels a thing, except for a lump in her finger. She wants to have the magnet removed, in fact, but the scar tissue that will have formed around it makes it a slightly involved operation, and one not covered by the NHS. I book her in for a CT scan. She can wear a lead apron, and there'll be very little radiation exposure for the baby. Although if I'd gone ahead and booked her an MRI, I'd have saved her the cost of that private operation. Sunday, 17 September 2006. Either the printer has gone insane or one of the receptionists has. Huge quantities of paper have engulfed the nursing station. Everyone in sight has collected around to try and fix it, all doing exactly the same thing, jabbing random buttons to absolutely zero effect. Pages are cascading out of the printer and onto the labor ward floor. I pick one up. They're patient identification stickers for a neonate, to go on notes, wristbands, etc. For the rest of the day, everyone checks their shoes and bags in paranoia, just in case a stray one has become attached. This is one label nobody wants to be walking around with. A slightly unfortunate surname means that every sticker says, Baby Raper. Monday, 25 September 2006. How the other half live. In an antenatal clinic, an extremely posh patient attends for a routine appointment. All is well with her extremely posh fetus. Her extremely posh 8-year-old asks her a question about the economy, and before she answers, she has an extremely posh 5-year-old. Do you know what the economy is, darling? Yes, Mummy, it's the part of the plane that's terrible. You can see how revolutions start. Wednesday, 27 September 2006. I'm off sick for the first time since qualifying. Work wasn't exactly sympathetic. Oh, for fuck's sake, spat my registrar when I rang in. Can't you just come in for the morning? I explained I had quite bad food poisoning and was in some kind of gastrointestinal meltdown. Fine, he said, with the kind of weary, simmering, passive aggression I normally only get at home. But phone around and find someone who's on leave to cover you. I'm pretty sure this isn't the protocol at Google or GlaxoSmithKline or even Ginster's. Is there a single other workplace where you'd conceivably be asked to arrange your own sickness cover? The North Korean Army, maybe? I wonder what level of illness would stop it from being my responsibility. Broken pelvis? Lymphoma? Or just when I was intubated on ITU and denied the power of speech. Luckily, I could manage to force out a few words in between bouts of vomiting, if not in between bouts of diarrhea, so I was able to organize a stand-in. I didn't explain what I was doing during the call. It probably sounded like I'd gone paintballing. And I now owe her a shift in return, so it's not even sick leave. I'd always suspected if I ended up off sick, it would be work that caused it. My money would have been on some form of emotional collapse, maybe renal failure from dehydration, getting beaten up by an angry relative, or smashing my car into a tree after a sleep-deprived night shift. As it happens, it was an altogether stealthier assassin, a portion of noxious homemade moussaka from a laboring patient's mother. I can be fairly sure that was the culprit. It was the only thing I'd managed to eat all day. There should be a saying about Greeks bearing gifts, I thought, sitting through the eye of an hypodermic needle, the taste of bile and faint tinge of aubergine in my throat. Sunday, 30 September 2006. Review a woman in triage who just arrived huffing and puffing away in labor. I ask how frequently the contractions are coming, and the husband tells me they're 3 to 4 times every 10 minutes, lasting up to a minute each. I explain I'll need to do an internal examination to assess how far dilated she is. The contractions of the womb make its neck or cervix go from closed before labor to full or 10 centimeters dilation at the end of labor, at which point baby can make its grand entrance. The first few centimeters can take an extremely long time, so women aren't generally admitted to labor ward until they're at least 3 centimeters dilated, like a strange nightclub you can't get into until you've had 2 gloved fingers in your vagina. Actually, there's probably one of those in Soho already. The husband tells me he checked before they left home, and she was 6 centimeters. Most dads-to-be don't peek under the hood, so I ask him if he's a medic. No, he tells me, he's a plasterer, but I know what a centimeter is, mate. I examine the patient and agree with his findings, making him more competent than most of my colleagues. Saturday, 7 October 2006. I've now spent 6 months being Simon's on-call mental health helpline since that first Facebook post. Anytime he's having worrying thoughts, I've told him he can ring me, and he does. I've also told him repeatedly to engage more formally with mental health services, but he's not so keen on listening to that bit. Aside from the fact it's a bit overwhelming to now have a second bleep threatening to go off with bad news any minute, I suspect he can get better help from someone who didn't have to panic Google what to say to someone who's suicidal. But it seems I'm better than nothing. At the very least, he's still alive. The most stressful part is discovering I've missed a call from him. If I call back too late and he's done himself in, does that make it my fault? Like I'm the one who kicked away the chair? I suppose it doesn't, but that's how you feel as a doctor, and probably why I'm in this situation to begin with. If you're the first to notice someone else's patient is breathing strangely or has abnormal blood tests, it's your responsibility to deal with it, or at least ensure someone else does. I'm pretty sure heating engineers don't feel the same way about every kaput boiler they encounter. The difference is obviously the whole life and death thing, which is what separates this job from all others and makes it so unfathomable to people on the outside. I call Simon back after a cesarean this evening. I've got my counseling sessions down to about 20 minutes. It's just a case of listening, being sympathetic, and reassuring him the feelings will pass. He must realize we have the same chat every time, but it clearly doesn't matter. He just wants to know if there's someone out there who cares. And actually, that's a very large part of what being a doctor is. Monday, 9 October 2006. Today we crossed the line from everyday patient idiocy to me checking around the room for hidden cameras. After a lengthy discussion with a patient's husband about how absolutely no condoms fit him, I establish he's pulling them right down over his balls. Tuesday, 10 October 2006. I missed what what the argument was about, but a woman storms out of a gynae outpatients, screaming at the clinic sister, "I pay your salary. I pay your salary." The sister yells back, "Can I have a raise then?" Thursday, 19 October 2006. My poker face has served me well over the years. It's seen me through an 80-year-old telling me about his use of a colossal butt plug called the Ass Master, and gently explaining to a couple in an infertility clinic that massaging semen into her navel isn't quite going to cut it, conception-wise. I sit there, nodding along blankly like the dog from the Churchill advert. "And what size of Ass Master, sir?" Today, however, my poker face cracked. On this morning's ward round, a medical student presented Mrs. Ringford, a 70-year-old gynae patient recovering on the ward after a posterior repair for a large prolapse. When you reach a certain age, your body attempts to turn itself inside out via your vagina, but you can avoid all this by performing pelvic floor exercises. There are leaflets that describe these exercises in confusing detail, but I always used to tell patients, imagine you're sitting in a bath full of eels and you don't want any of them getting in. Unfortunately, he called her Mrs. Ringpiece, and, much like the patient, I unexpectedly lost my shit. Monday, 23 October 2006. Called to A&E to review a gentleman in his 70s. I check with the A&E officer that he realizes he's bleeped gynecology. Reviewing a man would be rather pushing my remit. It's complicated, apparently. He'll explain when I get down there. I meet patient NS, a Sikh gentleman who speaks no English at all. He is on holiday, visiting family, and has been unhelpfully accompanied to the hospital by a relative who also speaks no English. Back's getting a little stiff the way I was sitting. Just gotta rearrange a bit. His history is therefore taken with the assistance of a telephone interpreter service. In this instance, a Punjabi translator is on the line, and the phone is passed back and forth. This particular interpreter may have rather fudged his CV. He seems to be able to speak only slightly more Punjabi than someone who can't speak any Punjabi whatsoever. Oh, my light just went out. It's alright. Hope you're still enjoying the book. The Stoic A&E staff have been making glacial progress using the interpreter and relay what they've established. The patient is bleeding from down below, has been doing so for the past week, and, crucially to my attendants, is a hermaphrodite. Hermaphroditism is a very rare intersex disorder where the patient possesses both testicular and ovarian tissue. It's named after the Greek legend of Hermaphroditus, who was said to be both male and female. He/she was the son/daughter of Hermes and Aphrodite, who it must be said had a pretty lazy system for naming their children. I tell the A&E officer that I sincerely doubt this elderly bearded man is part of the intersex community, and ask to speak to the interpreter. Can you ask if the patient has a womb? A phone gets passed back, and the patient starts to repeat a word to us very loudly and angrily in Punjabi. The patient furiously unbuttons his shirt to reveal a portacath. A portacath is a device that sits under the skin to allow easy injection of drugs and taking of blood for people who need it done frequently. This was our eureka moment. In unison, we all say hemophiliac, and I leave them to deal with his rectal bleed. Tuesday, 31 October 2006. Moral maze. In the labor ward dressing rooms after a long shift. I'm leaving at 10 p.m. rather than 8 p.m. thanks to a major obstetric hemorrhage ending up back in theater. I'm meant to be going to a Halloween party, but now I don't have time to go home and pick up my costume. However, I am currently dressed in scrubs and splattered head to toe in blood. Would it be so wrong? Saturday, 4 November 2006. Get bleeped to see a postnatal patient at 1 a.m. The ODP relays to the bleeping midwife that I'm in the middle of a cesarean. I get bleeped again at 1:15 a.m., still doing the section, and 1:30 a.m., writing up my operation notes. Eventually, I head off to review the patient. The big emergency? She's going home in the morning and wants to have her passport application countersigned by a doctor while she's still in here. Wednesday, 15 November 2006. I have entered the MRCOG Part 1 exam. Member of the Royal College of Obstetricians and Gynecologists. A necessary hurdle to proceed up the ranks. The exam is in 2 equally brutal parts and feels rather like the labors of Hercules, in that you're forced to do it to demonstrate your extraordinary dedication to the field more than anything else. A textbook advises me to try a past paper before I start revising. You might be pleasantly surprised by how much you already know. I attempt one. March 1997, Paper 1, Question 1. True or false, chromaffin cells, A, are innervated by preganglionic sympathetic nerve fibers, B, are present in the adrenal cortex, C, are delivered from neuroectoderm, C, D, can decarboxylate amino acids, E, are present in celiac ganglia. Aside from the fact I know what less than half of these words mean, and most of those are prepositions, I can't help wondering how it's relevant to my baby delivering abilities. But if it's what my insane demonic overlords want me to know, who am I to argue? Another textbook cheerily informs me that it's quite possible to revise for MRCOG Part 1 in just 6 months, with an hour or 2 study every evening. It's one of those phrases that is intended to be reassuring, but has the opposite effect, like, it's only a small tumor, or most of the fire's been put out already. I'm not entirely sure where these extra couple of hours a day are going to come from. Either I need to give up my frivolous hobby of sleeping, or cut out my commute by living in a store cupboard at work. Oh, and my exam's in 4 months, not 6. Monday, 25 December 2006. I don't particularly mind working Christmas Day. There are snacks everywhere, people on the whole are in a good mood, and there are very few worried well. A lot of individuals, I'm not calling them patients, there's nothing wrong with them, come to hospital under the misapprehension they're in any way ill, known as the worried well. If this is because of something they've read online, they're called cyberchondriacs. Generally, nobody rocks up as a patient on Christmas Day unless they're genuinely sick, genuinely in labor, or genuinely hate their family, in which case we've at least got some common ground. I'm not convinced H sees it this way, as we exchange gifts at breakneck speed before 7 a.m. Tradition at St. Agatha's dictates that the on-call consultant turns up and does a ward round on Christmas, which eases the workload for the juniors. The consultant will also bring a bag of presents for the patients, toiletries, Pantone, that sort of thing, because, well, it's pretty rotten being a hospital inpatient over Christmas, and the little things do make a difference. Best of all, tradition has it that this consultant will be dressed as Santa Claus as they do their round. The nursing staff's disappointment is palpable when today's consultant, Mr. Hopkirk, turns up around 10 a.m. wearing chinos and a jumper. Before the cries of Grinch and Ebenezer get too deafening, he explained that the last time he was on call on Christmas Day, he chucked on the outfit and beard for the ward round, and was halfway through when an elderly patient suddenly went into cardiac arrest. So he dashed over and started CPR while a nurse went to fetch a trolley. Usually, the CPR was successful. Unusually, the CPR was successful, and the patient gasped back to life to the sight of a 6-foot Santa lip-locked with her, his arms on her chest. "I can still hear her scream," he said. "Go on," says one of the nurses, like a child failing to hide their distress that their Christmas present is a calligraphy set, not a kitten. Maybe just the hat. Wednesday, 17 January 2007. In order to encourage use of public transport, there is no staff car park at the hospital. An admirable sentiment that would land me with a 2-hour, 20-minute commute each way. Instead, I've opted for a 70-minute drive, leaving my wheels in the visitors' car park. The pricing system must have been dreamt up by someone who realized their chances of winning the lottery more than once were pretty skeletal, and thought there must be another way to raise a similar annual revenue. It's £3 per hour, with no discount for long stays, and it's applicable every hour of every day and every night, except for Christmas, which presumably they decided would be greedy. The only exception is for women in labor, who get a parking voucher valid for 3 days when signed by the labor ward supervisor. I'm on good terms with the supervisors, not so much for the fact that day in, day out, I resolve obstetric emergencies, but because I occasionally bring in a box of Viennese whirls. As a result, they're happy to sign me a parking voucher every few days, and have therefore provided me with a marché gris parking space for the past few months. Today, however, the jig is up. My car has a clamp and a 120-pound fine for removal jammed under the windscreen wiper. I weigh up buying an angle grinder for 50 quid, but I've been at work 12 hours and just want to get to bed as quickly as possible. I grab the notice to find out who to call. The parking attendant has scrawled on the back, "Long fucking labor, pal." Just when I was thinking it had been a while since the last episode of Unexpected Objects Stuck in Orifices, today a patient in her 20s presents to A&E unable to retrieve a bottle she put up there. Speculum in. So what's it going to be this time? Chanel number 5, 2 liters of Tizer, the magic potion I need to drink to take me to the next level of that Dungeons and Dragons game I abandoned 24 years ago. As it transpires, it's a medical sample bottle filled to the top with urine. I can't work out the backstory, so ask her to enlighten me. It turns out she has to provide her probation officer with clean urine samples, and so, rather than choose the simpler option of not taking drugs, she has her mother piss in a pot for her, which she then smuggles in vaginally and decants into the sample pot she gets given by the probation officer. I think about the enormous volume of paperwork I'll generate for myself if I document this in the notes, so I pretend I never asked the question and send her home. Monday, 29 January 2007. My favorite patient died a couple weeks ago, and it rather knocked the stuffing out of me. It was far from unexpected. KL was 80 in the shade, with metastatic ovarian cancer, and she'd been on the ward as long as I've worked on this unit, minus a couple of short-lived discharges home. 5'0" of Polish sass, with bright, twinkling eyes. She loved to tell long, meandering stories from back home that she would invariably lose interest in the moment they got interesting. Almost all of them ended with blah, 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 and a vague wave of the hand. Best of all, she despised my consultant, Professor Fletcher. She called him old man every time she saw him, even though she had a good 15 years on him, regularly prodded her finger into his chest when making a point, and once asked to see his line manager. I genuinely look forward to her stop on the ward round. We'd always have a good natter, and I really felt like I'd got to know her. She immediately clocked I was Polish, despite 3 generations of my family living in England, breeding with Brits, and sending their offspring to expensive schools. She asks my original family name. I tell her it's Strakowski. She thinks it's sad a good Polish name like that is out of commission. I should be proud of my heritage and change it back. However, considering it's pronounced Strykowski, I'm not convinced it's a great name for a doctor. Over the months, I'd met all of her children, as well as numerous friends and neighbors who came to visit. Now they like me, she would say. Despite the joke, you could see why everyone did. She had a magnetic personality. I was really upset when I heard she died. I decided I should go to the funeral. It felt like the right thing to do. I swapped out of clinic this afternoon so I could make it, and let Professor Fletcher know I'd be attending as a courtesy. He told me I couldn't. Doctors don't go to their patients' funerals. It's unprofessional. I didn't quite understand why. His argument hinged on drawing a personal and professional line, which I agree with to an extent, but his tone seemed to suggest I was going along in order to seduce her grandchildren, or get myself written into the will. I suspect that underpinning is actually an old-fashioned sense that doctors have lost or failed if a patient dies. There's an element of blame or shame, not really a sustainable attitude in gyne-oncology, where there's always going to be quite a high patient turnover. I was disappointed, partly because I'd had a suit dry cleaned specially, but he's my boss, and those were his very clear instructions. Of course, I went to the funeral all the same, not least because that's exactly the kind of fuck you she'd have wanted to give him. It was a beautiful service, and I'm certain it was the right thing to do, for me and for the friends and family I'd met on the ward. Plus, I was able to sleep with one of her grandchildren. I'm starting to get a little sleepy. It's almost 2 a.m. here in England, so I'm gonna finish off my tea and then probably head off to bed. But man, we've really made our way quite a bit through this book already. I only got it very recently. I just ordered it off Amazon, but I'm just really enjoying it a lot. I just think it's so important as someone who wants to be a doctor. You know, that's eventually my end game, is that I want to be a physician, and I want to be OBGYN, and I just think it's so interesting to read a book from the perspective of someone who accomplished that and then decided that that was not what they wanted to do. They decided they wanted to quit and do something else with their life, and so I just really enjoy seeing that perspective. Alright, I hope the rest of you have a really lovely evening, and once again, I hope none of you get sick, so I hope you have a great night. I'll talk to you later.